Other news now. £5 billion a year. That's the cost of dealing with Scotland's drug and alcohol problem. But a report from the spending watchdog Audit Scotland says it's not clear whether we're getting value for money. Our Home Affairs correspondent Rival Alderson has been studying the report. Rival.
Jackie, we know only too well about Scotland's tragic reliance upon drugs and alcohol, but let's quantify the sorry and shocking picture. Almost 5% of all Scots over 16 are dependent on alcohol. Nearly 2% are misusing drugs. Drug and alcohol-related deaths have doubled in the last 15 years and are among the highest in Europe. The cost of our addiction is huge. £173 million goes each year on services funded by the government, but the wider cost to society is at least £5 billion. And this is the government spending watchdog's damning view of how we tackle this huge problem. They say there is no consistent understanding of what the money spent on drug and alcohol services has brought. We live daily with the effects of addiction, drunkenness and crime on our streets, drug-taking paraphernalia lying around, and the thousands on methadone treatment programmes. While the cost of all this is huge, it's not being monitored.
If you look across Scotland as a whole at the huge variety of partnership arrangements that are in place, there's no real comprehensive picture of what we're getting for the money, and certainly there's no real good information at the level of Scotland as a whole that this money is being spent as efficiently and effectively as it could be.
The effects of drugs and alcohol are felt daily in our courts. One Borders sheriff says the majority of cases before him are the result of abuse.
I find that 80% of the cases which I have dealt with have involved offences being committed whilst under the influence principally of alcohol, but commonly with combinations of alcohol and drugs.
Hospitals like Ninewells in Dundee are at the sharp end. They treat thousands affected by drink or drugs, but they also try to help the underlying causes.
They're asked 3 simple questions regarding their alcohol consumption. If they score a positive, they're offered alcohol counselling. And we're having about a 50% uptake on people going to the alcohol counsellor.
2/3 of government spending goes on drug treatment, and undoubtedly there are successes. Jackie was one, a cocaine addict who eventually sought help and is now helping other addicts with their problems.
Some services are having to cut parts of the service that work through lack of funding, and I don't see how that benefits service users. If something's working, then keep going with it.
Methadone prescription is the most visible treatment for addiction, but the lack of evidence about how effective it and other interventions are has appalled one of Scotland's leading commentators.
To be honest, it's a shocking indictment of just how negligent we have been in setting up systems to deliver drug treatment, knowing what they are, what they cost and how effective they are. And in almost every respect, we simply do not have that basic information.
Well, the Scottish Government says it's already working to get a clearer idea of the impact of its spending and has increased the amount of money going to alcohol treatment in light of figures showing 3 times as many people die in Scotland from drink-related causes as from the effect of drugs. Jackie.
Well, thank you. You're watching Reporting Scotland from the BBC. Still to come before